Well, this is very exciting. And on behalf of the Minnesota eHealth Initiative, we want to thank Surescripts for this Safe-Rx Award in recognition of Minnesota as the leading state in e-prescribing. We accept it on behalf of the many eHealth Initiative partners and all of the providers, pharmacists, and payers statewide that are really the professionals who have made all of this possible. A common theme associated with the success in Minnesota has been the strong commitment towards a common shared objective by a broad set of stakeholders for achieving e-prescribing. There are, I think, 4 areas that show evidence of this, and they include, first, the Minnesota eHealth Initiative, a public-private collaborative effort to support adoption of electronic health records and e-prescribing, and that is guided by a statewide eHealth advisory committee that's legislatively chartered. They've invested years of work to identify gaps and challenges. They've developed and published practical guides for prescribers and dispensers. They've made recommendations to the Commissioner on policy and funding that have been implemented, and they've sponsored an eHealth Summit annually to share valuable lessons. The second area is the strategic use of assessment data to really help describe the level of adoption of e-prescribing technology and electronic health records. And this has been essential to focus attention on the largest gaps and needs throughout the state and allows resources to be directed to where they will have the greatest impact. And then using financial incentives has also been a key factor. In 2006 to 2011, grants and loans have been provided to areas of need, especially in the rural and underserved areas. And in 2011, an outreach grant program that targeted 45 pharmacies in rural and underserved areas to help them adopt e-prescribing technology. The fourth reason is the use of policy levers, and 2 of the more visible levers are distinctive in Minnesota, and they are, first, the 2015 mandate for interoperable electronic health records, and the second, the 2011 mandate for e-prescribing for all prescribers in Minnesota. These have been key to the success in Minnesota. E-prescribing has helped Minnesota meet its broader health care objectives by first serving as a catalyst to look at implementing the complete electronic health record. Next, it's encouraged providers to look at their workflows so that they can actually improve processes to improve safety and help avoid adverse events. And then thirdly, it's supported population health, the goal for broader, healthier communities. Minnesota law for e-prescribing did impact in a number of ways the ability for e-prescribing to occur in Minnesota. Prescribers and dispensers tell us that it created a sense of urgency and a focus for them and their communities statewide. We believe it also established an environment that promoted e-prescribing as a very valuable practice. It also accelerated efforts at collaboration and sharing of lessons learned and best practices through workshops, trainings, and what became a very hot topic for many program agendas. In Minnesota, we have at least 4 goals to continue to expand and improve the use of e-prescribing statewide. These include, first, expanding the capability by filling the remaining gaps, especially in the very rural and underserved areas. The second, to increase the proportion of prescriptions that are actually submitted using e-prescribing. The third, to focus and leverage resources by using assessment and evaluation data to identify good practices and also opportunities for value added, if you will, continuous improvement. And then fourthly, to expand opportunities to prescribers in other domains beyond the ambulatory clinic and hospital settings. We are very excited about e-prescribing into the future and sharing the lessons that we have learned. And personally, I am very honored to be part of the Minnesota Department of Health team and the Minnesota eHealth Initiative Advisory Committee, a truly public-private collaborative that is made up of so many talented experts who have committed a tremendous amount of time for the benefit of so many statewide. I'm gratified that our collective efforts can help contribute to improving the health of all Minnesotans. Thank you very much.